Good morning once again, everybody. My name is Paul Newhouse with the Client Services Department at Celtex Therapeutics. Happy to be with you this morning to continue the Celtex webinar series. Again, the topic today is myths and misconceptions around stem cells. Have the pleasure of being joined today by one of our physician partners, Dr. Derek Guillory in San Antonio, Texas. Dr. Guillory, good morning.
Good morning. Thanks for having me.
Sure. So before we get started here and jump into some questions and topics around myths and misconceptions, Dr. Guillory, do you want to take a minute to introduce yourself and tell us a little bit more about what you're doing in the area of stem cells and functional medicine?
So I am board certified in emergency medicine and have practiced for many years in hospitals and in clinics and urgent care clinics, operating several different clinics. I'm doing full-time functional and regenerative medicine only now, and I have a broad patient base that ranges from super athletes doing triathlons several times a year to weekend warriors with minor athletic issues and just wanting to be the best athlete and person that they can be, all the way up to chronic disease. Taking care of patients with cancer and neurodegenerative disease and autoimmunity and things like that. So a broad base of patients and using stem cells whenever I can to help people get well. So that's a brief summary.
Great, great. And I know you do a lot more as well, but thanks for summarizing that for us. We've had the pleasure of working with Dr. Guillory for going on at least a few years now, and are very happy to have him as part of our extended family here at Celtex. So without further ado, Dr. Guillory, let's jump into some topics here and some myths and questions and things like that on stem cells. So sound good to you?
Sounds great. Let's go.
All right. So the first one here we have posed is stem cells are only for those who are at the end of their life. And I'll add to that slightly and say one of the things that we get frequently is stem cells are only for those who have severe chronic conditions or are far along advanced on the disease spectrum. What do you have to say to that?
So I think that, that's a huge misconception. There are a broad base of patients that have a benefit from stem cells, and you've probably seen people like Dave Asprey and others, the founder of Bulletproof Coffee, that are using stem cells for anti-aging, or for performance, or even for just prevention. So there are patients that are using stem cells to try to help stay as young as they can be for as long as they can be. So, and like I said, I have patients that really have no medical problems to speak of, that are doing a whole bunch of things to try to maximize their performance, prolong their ability to compete in a sport or in some activity, and all that, and all through the spectrum, all the way up to people with severe chronic debilitating disease. And so I think that it's wise to consider stem cell therapy for just about anybody, at least to try to decide if it's worth pursuing. So you don't have to have a chronic illness to look into stem cell therapy.
So in other words, we have a full spectrum of people. We have those who are advanced in disease or some type of chronic illness, and certainly stem cell therapy can be suitable for those folks. But you're saying at the other end of the spectrum, we have this population or cohort of people who's otherwise healthy and may just be interested in stem cells for general wellness, preventive purposes, anti-aging, and then everything in between. So really across the disease spectrum, there are applications for stem cells.
That's right.
Okay, great. Another popular myth or misconception that we come across regularly is there's no point to banking your stem cells proactively, or there's no point to banking your stem cells until you're going to need them for some type of application. What do you have to say to folks who are, I guess you could say, waiting for a more urgent need to bank their stem cells? Should they do it sooner?
It's a good question. I think I say this a lot, and I'll use my own personal experience. So I have, I'm a family of five. So I have a wife and three kids. My youngest is 12. I have a 14-year-old, a 16-year-old. She's gonna be 17 actually next week. And we banked ourselves more than a year ago. It took me a little while to convince my wife to let me bank my little one's cells, but we finally got it done. And I think that the best time to bank your cells is before you need them. Why people have asked me, why in the world would I bank my at the time 10-year-old's cells? And the main reason I did that for him is because you're never going to have as many stem cells as you have today. So he has more stem cells per gram of fat tissue when I'm doing the extraction right now than he'll ever have. And that they continue to decrease in number with age. So we get a better bank when you do them younger. Now that doesn't mean that you shouldn't bank your cells if you're up in age, because we still get a good bank, but it's just the best number of cells when you're young. And then also, more and more research comes out every year about the utility of stem cell therapy for both chronic and acute disease. So the main reason I banked my cells, if I had to pick one for my teenagers, is the potential for a therapy in traumatic brain injury or traumatic spinal cord injury or traumatic peripheral nerve injury or traumatic severe bony or musculoskeletal injury, because you can't predict when you're going to have an injury, and to have your cells banked is, I feel like it's an incredible privilege, because if my son in football had a brain injury, he would be getting stem cells as soon as the stem cells are ready. And I have them banked. So I don't have to worry about some of the other, we could talk about the differences between stem cell therapies, autologous, your own cells versus someone else's cells versus all sorts of other products in between. But I'm a big fan of, if you have the option to have your own mesenchymal stem cells given to you for an acute traumatic injury, that's the best option. So.
Sure. And let's stay on this topic for a second, because I think banking is just so important. Everybody knows about cord blood banking and all of these types of different banking activities that are done at hospitals when children are born. It's commonplace. Do you think that adult stem cell banking is moving in a direction where it can or will or should be as commonplace for adults, adult stem cell banking, as it is now for people who are banking their newborns' cord blood?
I think it should be, if you're asking me that question, just because there's, we can't even predict what types of therapies are going to come out in 10 years. And so we've already seen some preliminary studies on COVID, on severe COVID, and how using stem cells as a treatment for that acute condition, which, didn't even exist 5 years ago. And now we have a potential very effective treatment for that illness. So, for me, this is a really easy question to answer, because I don't know what I don't know. And there might be some other illness in 5 or 10 or 15 years that stem cells may be effective to treat. This is very easy to bank them. So if you ask me the question, should it be a commonplace therapy, then yeah, I think it should be, and people should bank their cells. I'm convinced we're going to have some pretty good clinical data on stem cell therapy in stroke, in Two big, I like to break things in twos. You've got acute illness and chronic illness. Chronic illness, there's already some good data on degenerative conditions like arthritis and multiple sclerosis and Parkinson's, and dementia. But acute illness, I think we're going to get more data on those types of illnesses. And there are a lot of mouse studies on, for instance, complete transection of the spinal cord. Somebody has a terrible, debilitating, life-ending spinal cord injury. We don't have human studies on this, but the mouse studies are really, really encouraging. So we're going to get a lot of data on acute injury like stroke, traumatic brain injury, spinal cord injury, athletic injuries. This is my next really good area of research is like ligament injury. So you have like a severe ligament injury in the cervical spine or even ACL repair. There's some data that's coming out on non-surgical ACL repair in the knee. Traditionally, if you're an athlete and you tear your ACL, you have to have surgery, your career's over. Mm-hmm. Well, there's already some data coming out for non-surgical repair of ACL injuries where you use stem cells. Like this is going to be really exciting. So both for acute and chronic diseases.
So just to put a bow on that topic, and you mentioned it with your son, and God forbid he has a football injury, timing is critical, to intervene if there's a TBI or, as you're mentioning, a tissue injury of some sort. Timing is critical. And of course, as we start talking about an older population, things like a heart attack or a stroke, an ability to turn around those stem cells on shorter order, if someone already has banked them, would certainly be beneficial. So they have some good points there about banking. I'm interested to hear your thoughts on this next one, Dr. Guillory. In doing past presentations with you, I love some of what you have to say on this topic, and that is the notion that stem cells can only benefit you if they're growing new tissues, cartilage, nerve, whatever the case may be, but they do other things, don't they?
That's right. So it's a really common misconception that the cells have to become some new tissue in order for them to do good work. And there's a lot of data actually showing that that's not true. And for some that's disappointing. For instance, if we put stem cells in a joint, people want those stem cells to become new joint tissue, like a, injection of a joint replacement, which may happen. We don't really know. The data is not out yet. But the good news is that it doesn't even have to happen. So these cells, MSCs stands for mesenchymal stem cells. I like to call them master signaling cells. Mm-hmm. So the MSC is a master signaling cell, which receives information from its environment and then does something about it. And so the cells are sending out signals to the existing tissue, and they're saying heal, regenerate, don't be inflamed, be well. These are the messages they're sending, and they're calming down inflammation and degeneration. And the cells are really, really smart. So they both, this is why I like a live cell best when you're comparing some of the biologic tissues that you can use in regenerative medicine. The live cell I much prefer because it's able to assess the environment, whereas a Wharton's jelly product or an amniotic fluid product or a placenta product is what it is. It's not gonna assess the environment, whereas the cell can do that. And then those cells can and do release factors that the environment needs. So whether it's a signal to improve blood flow to the area, that's a really good thing to do, improve blood flow. But in some cases, it's not a really good thing to do. You don't want to always improve blood flow, but the cell can figure that out. if it's a live cell that's assessing the environment. So yeah, you don't need the cells to become a new nerve or to become a new meniscus or a new tendon. What those cells can do is just send the information to the existing tissue to heal. And we know that that happens. There's data showing that, where the cells don't become new tissue, but they encourage the existing tissue to heal and to do the things that it's supposed to be doing.
Yeah, it's great. It's, you know, in my years and in working with stem cells, I've certainly seen an evolution in what we, even in my short time, in the way we understand MSCs to function, and some of the actions and mechanisms in the body with which they propagate some of these repair and regeneration activities. One thing I wanted to just reiterate out of what you just said, great information about the functions of MSCs and doing other things other than differentiating into cartilage or nerve or whatever type of specialized tissue. But you mentioned the Wharton's jelly product, the placental product, the amniotic fluid. We get asked about those things all the time because they're commonplace. Your doctor down the street, your chiropractor down the street are using these types of off-the-shelf allogeneic products. And what I heard you just say is that, well, you said these things are what they are, right? But they do not have the same capabilities of one's own MSCs to communicate, to dictate, to signal. Is that right? Did I hear that correctly?
Right. Yeah. And I don't want to put down any other product, but you know, that's true. Those products, unless it's a living cell, they don't have the ability to assess the environment. So those products, for instance, like one of the things that stem cells do is they release a factor called fibroblast growth factor, and fibroblasts create new collagen. So new collagen is new cartilage. So in a joint repair, for instance, fibroblast growth factor will help the cartilage, the chondrocytes, lay down new collagen and make new cartilage. So the stem cells actually secrete fibroblast growth factor when they're in an environment where that needs to be done. So if I put stem cells in a joint, that's a really good thing for the joint. But if I put stem cells somewhere else, well, it may not be necessary. Mm-hmm. So the little vials of product, various vials, for instance, if I'm speaking generally, they will actually have some fibroblast growth factor in them, right? Mm-hmm. But it's an amount. It is what it is. Yeah. When you put fibroblast growth factor in there, it's there, and no more can be made. It's just what's in there. Whereas the cell can make it and then can wake up the next day and say, oh, I think we should make some more of that. And they make some more of that, and then wake up the next week and do it again. So you just can't compare the two products. Not that one is incapable of doing anything good, because that's not true, but they're just different. Sure. It's not the same thing. And they're being marketed as the same thing. Like, you know, come get stem cells at whatever office. They're not the same thing. Most of them are not live cells. Some of them that have claimed to be live cells have been proven to not be live cells. And it's a little bit of the Wild West in some of those markets right now.
Yeah. Yeah. Well, that's some good information for the audience, and potentially something that we can address further in a future webinar and dig into a little more deeply. The next question I'd like to pose, Dr. Guillory, goes back to banking the stem cells, and the concern that some folks have that once they bank their stem cells for a long period of time, that over time in cryopreservation, those stem cells will become unviable in time. But we know that to not be true. They can be cryopreserved for extended periods of time with little to no loss in viability. Is that your understanding as well?
Yeah, this may be better asked to the PhDs in the lab, but my take on it is, we cryopreserve living cells across multiple disciplines, so including babies with their cord blood, including embryos for in vitro fertilization for many years, many years. There are cryopreserved cell lines in existence for decades, multiple decades. And so the technology is there for those cells to be viable for a really, really long time. And all the scientists that I've spoken with across multiple fields have confirmed that there's no risk of those cells becoming non-viable as long as they are preserved according to really strict guidelines. I'm a clinician, I'm not a scientist, so that I can't speak with as much authority on it as maybe Jane can.
Mm-hmm.
And others.
Jane Young, our Chief Scientific Officer.
But I know specific, that was when I first started my relationship with Celtx, I asked that question and visited the lab, and Jane gave me assurances that even, the 90, I think my oldest patient right now at Celtx is 93, 93. And there's no expectation that his cells would not be viable when he wants them delivered when he turns 121. So he wants to live to 121, and that's our goal. We set it out, and he's going to go to his 100th year college graduation, and with a whole bunch of other young people.
Yeah.
So yeah, I don't have any expectation that the cryopreservation technology is inadequate.
Yeah. Wonderful. And I can speak from experience. I do have some of those guys that you know out there in San Antonio who are well into their 90s. And I believe my oldest client that I've worked with at Celtx, she is 98 or 99 and still continues to receive booster infusions, and her cells grow very, very well in the lab, and she's doing very well. So it's pretty remarkable to see some of these folks of advanced age.
Yeah.
So that's touching on the age component a little bit, that age isn't necessarily a limiting factor. Would it be better for everybody to bank, at the age they are, you banked your kids' stem cells? Yeah, that'd be much better, but age isn't necessarily a limiting factor. But a little bit of a spin on that notion here is what we hear when people say, okay, I have a chronic condition or chronic illness. Don't I need a healthy donor stem cells in order to improve my health condition? I can't use my own stem cells. Is that true? Can't someone still use their own stem cells even if they do have a chronic medical condition?
Right. I mean, there's a lot of misconceptions buried in that one myth, because the primary one is really, well, whose cells are you getting when you're getting someone else's cells, and are they actually cells? Because the odds are, if you're getting some healthy donor cells in a vial that's available at some doctor's office, they're not live cells. Those are extremely uncommon and becoming more and more uncommon because of FDA regulations. So that's, a major misconception. The other part is, the main problem with older people's stem cells has stemmed from information that we have from same day procedures. So there are two procedures that you can get today for your own stem cells, where you go to the doctor, they stick a big trocar in your hip and pull out your bone marrow and purify a small portion of bone marrow derived stem cells, or they take your fat on the same day and they purify a small portion of those stem cells that they get out of your fat.
Mhm.
In older people, there are very, very few stem cells in those purified components. And so patients don't have a great response from those procedures, not because their stem cells are ineffective, but because there aren't enough of them.
Mhm.
And so, you know, all these misconceptions are mixed in together. So you can't compare, 50,000 stem cells that you got in a same day procedure to 400 million that you got from a culture expanded stem cell from Celtex. So they're two totally different things.
Yeah.
The power comes both from the type of cell and the number. So you need the right stem cell and you need enough of them. And so that's what the Celtex product would be. But also the main thing is you can't compare a product that's not a live cell. So there are major benefits to those epidermal growth factors and fibroblast growth factors and vascular endothelial growth factor that ends up in those little off-the-shelf products, but they're not the same thing as a cell. And older people need more of the signaling from more cells. And there's a great benefit to those cells when they're given in the right number, in the right way, and the right type of cell.
Mhm.
Does that answer your question?
Great. Oh, absolutely.
Sometimes I chase rabbits. It's hard for me.
No, I think that's great information. This last question, and I say last question because it's the last one that we have preset, and then we'll be happy to take some questions from the audience. If you'd like to submit those into the Q&A or into the chat, please feel free to do so. But this last one for you, Dr. Guillory, again, kind of a multi-layered topic here. So stem cell therapy is an alternative to conventional medicine. So I'd like to discuss a couple different areas with this. One, stem cell therapy is a complete replacement for all prescriptions, medications, and all surgeries. We know that to not be the case. There are some limitations, so I'd be interested to hear your thoughts on that. And secondly, and this goes into a lot with what you do at Root Causes Medicine there and functional medicine, is that stem cell therapy is the end all be all in the sense that it's your one-stop shop for health and wellness. Don't worry about your nutrition. Don't worry about your lifestyle habits and all these things. That's not true either. So what do you have to say about this notion that stem cell is a complementary piece to the puzzle here of someone's overall health picture?
Thanks. That was a softball you lobbed up there for me. I like that. No, stem cells, a lot of people like to treat any modality as the be all end all, just because it makes it easy, I think, to think about. But with all my patients here, I try to do a comprehensive approach, because the master signaling cell is an incredibly powerful tool in my tool belt for really sick patients and for patients who are just trying to prevent illness long-term or anti-aging or be super athletes. But it ideally, I should say, it doesn't have to be, but it ideally is a component of a comprehensive plan. Mm-hmm. Because if somebody has degenerative signaling that is here, and there's a whole bunch of things that contribute to degenerative signaling. One is just how many years we've lived on the earth. Another is the food we eat, and how much do we breathe in unclean air, whether that's from the smog in Los Angeles or the cigarette in our hand. The food we eat, the water we drink, the air we breathe, all these things, electromagnetic radiation, and other environmental toxin, chronic infections, right? These are degenerative signals. The stem cells in some patients, you give them one dose of stem cells and it comes up to here and they feel great because it overcame the degenerative signaling, right?
Mhm.
But in other patients, if you're right here, you don't ever overcome the degenerative signal. So if we can lower this and raise this, there's a whole bunch of things that contribute to regenerative signaling, to anti-aging rather than aging, right?
So really, we've got a scale of disease and health here that we're trying to tip that scale back in our favor.
Well, and in truth, this is a simplistic analogy because it's a three-dimensional orb of complicated factors that include genetic factors, immune factors, environmental factors, lifestyle, stress. All these things are competing, to harm us or benefit us, right? And so I'll talk a lot about all those things, and I'll use stem cells as a really powerful tool in my tool belt to get people well or keep people well. And I do it both with different patients. But it's really, I get frustrated when patients just want to do stem cells, or they just want to do one thing, whatever that one thing is, not thinking that, for instance, the food that they're eating is impacting their joints, which is just not true. You have got to think about all these things that are adding up to try to harm you. And if you think about enough of them and get that number down, the stem cells are going to win.
One thing I did want to ask you, Dr. Guillory, before we go, is let's take a look at the future. What does the future of stem cells look like, in your opinion? You mentioned some of it earlier, as far as we don't know what we don't know. There's a lot of things to come that we don't know yet. We've talked about banking and all these things, but what would your final summary be on where you see and where you envision stem cells going in the future?
I think they're going to become a major part of advanced medical care. So when I think, no offense to the surgeons, I love my surgeon friends. They are incredibly talented and needed. But, if I have to compare something as simple as an ACL repair, a major ligament repair surgery in the knee in an NFL football player, a great majority of college and professional athletes have had that surgery. Well, if I could take care of that injury with a percutaneous non-surgical procedure that gets the same result, everybody wins. This is like, you see what I mean? It's a no-brainer. So I think that we're going to see more and more therapies coming out of the research that's being done on stem cells. And we're going to, for people that are willing to invest the thought and effort and time into changing their life and correcting all those things that are trying to harm us, and use stem cells together with that, we're going to see some great results, because I see it every week. And so I think it's going to become more and more commonplace. And as time goes on, thankfully, I believe it will become less expensive. Right now, the main problem is the cost. So as we get better at it and time goes on, as long as market forces are allowed to exist, the price will come down and we'll be able to help more people with the great therapy.
Yes, so accessibility and affordability, certainly a couple things that we're interested in helping push forward. Okay, I do have the questions up here, Dr. Guillory. Maybe if we could just do a couple.
Yeah, sure.
Stepping out of myths and misconceptions a little bit, let's do just a little rapid fire as far as your opinions on stem cell therapies for particular issues.
How effective is stem cell for Parkinson's? Parkinson's is a complex illness. some patients get a great response with the stem cell therapy for Parkinson's. Parkinson's must be addressed in a comprehensive way. And so the chronic neurodegenerative conditions, we see some incredible results with some patients, and particularly the ones who are willing to invest a lot of thought and effort and time. So hopefully that answers your question. But yes, it can be effective for Parkinson's. And in some people, they get a dramatic response with just stem cells. I never recommend only stem cell therapy for Parkinson's or any other neurodegenerative condition, but I do use it for that condition. Kidney regeneration, is there a protocol? So there have been some dramatic recoveries in patients with chronic kidney disease. There is not like a protocol that always works or anything like that. It's a case-by-case basis, but yes, I have had some patients get better from chronic kidney disease.
Prior to dialysis.
Prior to dialysis.
Yeah.
I've never had a patient personally come after they've already been on dialysis. So I don't know.
That's probably our point of no return when it comes to kidney issues is dialysis.
Multiple sclerosis patients will often, there was a question about multiple sclerosis. Multiple sclerosis patients will often have a noticeable improvement, but again, complex neurodegenerative condition. You got to have a comprehensive approach. But there are many patients. That's a large group of Celtx clients, actually, right? We have a pretty large following.
Absolutely, yeah. Probably right after osteoarthritis and right up there with Parkinson's and rheumatoid. But yeah, MS is towards the top.
And then there's a question: should the patients use their own stem cells to treat their Parkinson's disease? So, I mean, that's sort of a lot of questions within that question. There are some great benefits to using your own stem cells for anything compared to someone else's stem cells. Like I said, the main problem with that misconception is that people are being lied to about the product that they're getting. So if you're getting some other product that is someone else's stem cells, I would be very surprised if it's a living cell. If it is a living cell, there are some great benefits to that as well, and there's some good data on it. Most of those therapies are being done in other countries, and again, there's a benefit and a risk to everything. The primary risk to using someone else's stem cells is unknown risk, which is what does that person cells in my body, what is it exposing me to that I don't know about? And now, is that a risk that is not able to be overcome? No, it's not. And we give blood transfusions every day in this country in hospitals, and patients do really, really well with other people's red blood cells all the time. So it's just a risk that you have to weigh out. So there's a huge benefit to having your own cells because they're your own cells. You're never going to reject them. You don't have anything that's unknown. And with the culture expanded product, you get a really good number of cells that are powerful to do the job that they're created to do.
Right. Last one here, and let's end on a tough one here, Dr. Guillory. I know that you don't have any data for this particular issue, but do you have any opinion on the prospect of stem cells for leukodystrophies and leukoencephalopathy?
So I don't have any experience with that condition. I would venture to say, out on a limb, so I never ever lose hope for anyone. So I have patients that call me all the time from the other side of the country or the planet who say, can you help me with my fill in the blank.
Mhm.
The most recent one was spinocerebellar ataxia type 7.
Yeah.
And I told this mom who called me, I have never heard of spinocerebellar ataxia type 7, but I'm happy to try to help. Leukodystrophy, I just don't have any experience with, but this is a quick little push for, there are only four things that determine whether someone will get better. 2 causes for all disease: deficiency and toxicity. That's everything your body needs that it doesn't have, and everything your body has that it doesn't need. Those are the only 2 causes, and 4 factors that determine whether someone will get well. This is always true: belief, thought, effort, and time. If you have all 4 of those ingredients, people can and often do get completely well. Time is the tough one because you don't want to run out of time. So the best time to start is yesterday.
That's really interesting. The 2 I've heard you say before, the 4, that's a new one. That's interesting. I like that.
Belief. You have to have belief. And belief is complicated. I can talk about that for a really, really long time, but you have to believe that you can get well. You have to want to get well. You have to, no, that's belief. And it is a necessary ingredient. But stem cells come in effort, thought, effort, and time. The stem cells are very effective, I believe, and there's also data. So it's more than just belief. It's not blind faith. Thinking about how to do them, and in combination with a comprehensive approach, effort, working, you got to work. And then time, you have to do all of this for long enough to overcome all of the signaling that's causing us harm. So that's my long answer on leukodystrophy, which is essentially, sorry, that may sound like a cop-out. I don't know enough about leukodystrophy to say whether it would be effective or not, but never give up hope, because I have seen some things that I have never heard of. Patients get well when you treat the 2 causes of disease and you have those 4 factors.
Yeah. Well, that's a new one on me as well. For that lady who posed that question, though, we'd be happy to follow up with you and see what can be done. But I think we'll wrap up there. Dr. Derek Guillory, Root Causes Medicine in San Antonio. Great information today. Thanks for taking the time, Dr. Guillory. We look forward to having you back on a future webinar soon.
Great. Yeah, thanks for having me. Appreciate it.
You bet. Okay, so for everybody else, if you have any questions that we didn't get to, or questions that you think of after we wrap up here, feel free to reach out to us, talk to the team. Myself or another member of the client services team will be happy to follow up with you. We would be happy to receive your questions and your inquiries at webinar@celltexbank.com. First step is always banking your stem cells, so that's probably where the conversation starts. But if you have any other questions, we'll be happy to answer those. Our next webinar will be coming up on Wednesday, August the 4th, again at 11 a.m. Central, and we'll revisit a topic we discussed way back when we began the webinar series last year, talking about the CellTex difference, what sets us apart, and maybe an expansion on some of what Dr. Guillory was discussing as far as what differentiates what CellTex is doing with MSCs versus some of the other off-the-shelf products with which you may be familiar. And lastly, I know a lot of people like to view these webinars on demand or share with their friends. That's great. You can view those on our website, celltexbank.com/webinars. So again, thank you for joining us this morning. We look forward to seeing you again Wednesday, August 4th at 11 a.m. Thanks and have a great day.